This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. Steve Love along with Thomas Miller. And we're going to continue a discussion about COVID-19, but we're going to move a little bit away from the treatment of COVID-19 to some of the things that impact mental health and behavioral health. We're delighted that we've got Ann Warren with us today, and she holds many jobs at Baylor Scott & White. She's in the Research Center as the Director of Behavioral Health for Baylor Scott & White Research. She's co-director of the Trauma Research Program at Baylor University Medical Center, and she's program manager at Baylor Scott & White Medical Psychology Consultants. Ann, welcome to the show.
Well, thanks for having me.
You know, as we look at all the different aspects of COVID-19, and there's been lots of them, they impact us in so many ways. What are some things from the unique aspects of COVID-19 that are impacting mental health in such a way that other types of illnesses have not?
You know, it's really a great question because I think we're all trying to put some framework around this and what is this going to look like for mental health long term. In some ways, we can compare it to other traumas. So you might look at 9/11, you might look at a natural disaster, and there's some similarities, right? It's an unexpected event. But unlike, let's say, a natural disaster, so let's say there's a hurricane, we kind of have a mental framework for that, right? We know the hurricane is coming. We kind of have a typical cognitive set for what that looks like to go through a hurricane. There's you need to take shelter, there's the aftermath, and then people know when it's safe. But in this situation, it's very unique, I think, because we don't have that kind of framework. We don't know what this looks like down the road. And so that sense of maybe prolonged or unusually long uncertainty that seems to be coming with this, I think is one of the things that's going to make it different from an emotional health aspect.
You know, as you think in terms of the unknown and fear, there are many people, and we've had a cardiologist on this show recently to talk about such fear associated with being infected with COVID-19 has kept people from coming to the hospital for emergencies such as heart attack or stroke, but also routine type things such as vaccinations. In your position, what advice would you tell people how to cope with that kind of fear?
Well, I think it's about putting things in perspective, understandably, and I think this goes back to uncertainty. You know, because there's a lot of maybe different information, mixed messages on how the virus spreads and how this can affect certain groups, and because we don't have all that knowledge fully vested yet, then I think people are understandably fearful. So I would start by saying I would normalize that fear, right? There's a fear of saying, if I go to a hospital emergency room, I may be more likely to contract COVID-19 from someone sitting next to me in the emergency room. But the reality is, if people are experiencing symptoms that would require an emergency room visit, they really need to go. You know, that message is not any different. The worry, I think, and probably the cardiologist who spoke with you recently, I'm guessing, probably said the same thing, which is, you know, we don't want people to be more at risk by not taking care of their health during emergent situations. One thing I can tell you at Baylor Scott & White that we've started, there's a wonderful program, Baylor Scott & White Safe Care, and you may have had guests that have mentioned this, but Baylor Scott & White is really taking a very proactive approach, looking at preventative measures and virtual visits and virtual waiting rooms and making sure they're doing accelerated cleaning and COVID-19 testing when appropriate. So our healthcare system is spending a lot of time ensuring that things are as safe as possible so that people don't miss emergent and routine care.
You know, we think in terms of the people that contract COVID-19, and we think in terms of, just like we talk, people coming to the hospital. But, you know, there are other people being affected by this pandemic. there are many essential workers and many of the frontline healthcare workers. How are they feeling about the pandemic, and what impact is this having on them?
So it's such an important question. And, it's really fascinating. Right now, there is research coming out of many countries that have been at the forefront of the pandemic before it came to the United States. So countries in Europe, Italy, Spain, China, they've been looking at how is this affecting their healthcare workers. And what they've found, no surprise, is there's been higher rates of depression, higher rates of anxiety, post-traumatic stress symptoms. And the reasons are probably obvious, right? Because these individuals, both abroad and in the United States, our healthcare workers are going into, again, that uncertainty, the unknown situation. And there's a lot of understandable fear, fear that they might bring the virus home to their loved ones, the fear of what are they walking into every day when they're going into the units. And so again, we want to be very careful about how our healthcare workers are being impacted emotionally. We have, one of the things we did early on here at Baylor Scott & White was we developed a peer support hotline so that anyone with Baylor Scott & White can call 7 a.m. to 11 p.m. and they can talk to a peer support, a trained peer support, and who's trained in psychological first aid. And what that allows them to do is for that frontline healthcare worker, if they need a place where they can just vent and talk about their fears, they have that available to them. And then if that level of fear or worry becomes even more, to where it becomes truly an anxiety or a depression episode, then we connect them with our licensed mental health professionals in our system. So, that's just one example of what our healthcare system is trying to do for our colleagues. I might also add, kind of with my research hat on, we have been studying the psychological impact of COVID-19 with a particular emphasis on healthcare workers. And we're really hoping to look at people long term to better understand what people are experiencing, and not just the negative psychological emotions like depression and anxiety, but we also want to look at how people are coping and resilience. Again, if we go back to trauma, and 9/11 has some great research that came out of that from George Bonanno, who's kind of a famous researcher in the resilience world. But, what he found was that even under the most difficult of circumstances, first responders after 9/11 remained resilient, meaning most people had a little bit of distress or even a moderate degree of distress in the beginning. But over time, if you watch people over time, they're naturally resilient to traumatic events. So we really want to encourage people's resilience, help them cope. And when I'm working with people clinically, I remind people, you've got all these great tools in your toolbox that have helped you cope with other difficult life events. And those didn't go away just because we're in the middle of this event. We've got to use those coping techniques and help people support what's worked for them and maybe give them some new tools as well.
And we're going to take a quick break here, but Dr. Ann Warren from Baylor Scott & White will be back with us in the next segment. 20 years with Baylor as a clinical psychologist and research director. And we're going to come back and tackle some of the tough questions around these challenges we are all facing today, including an increased alert of suicide attempts. What can we do and what resources are available? Next on The Human Side of Healthcare.
This is The Human Side of Healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
And welcome back to The Human Side of Healthcare. Thomas Miller here along with Steve Love, and we are continuing our conversation with Dr. Ann Warren. She is a PhD psychologist and is co-director of the trauma research at Baylor Scott & White Health. She and her teams have obviously closely been following the progression of COVID-19's effect on all of us, healthcare workers, you and me, and those who have actually had to battle this disease and come out on the other side. From her research perspective and her clinical perspective, she has incredible insights. So here again is Steve Love and Dr. Ann Warren.
So let me pivot just a minute from the frontline healthcare workers to our listeners. What are some nuggets of information or tips that you could tell them that they need to use to help with the emotions surrounding this pandemic?
Yeah, so there has been some research from other similar events, from SARS, from MERS, and what they found, interestingly, are some things that are probably not too surprising, but some that might be surprising. So, for example, media exposure. Now, it's important that people get accurate information about events that are occurring, but what the research continues to show is that overexposure of media. So if you're someone that you're on your phone and you're getting those alerts every 5 minutes about, the latest COVID-19 related story, if that's a 24/7 event for you, it's probably good to kind of pull back a little bit on media exposure, because that's shown to increase anxiety and depressive symptoms. What may be better is to think about a balance, right? So if you're going to spend time getting some media exposure, making time for maybe more pleasurable events or less stressful events. So kind of having a balance for that. So media exposure and cautioning about the amount of media exposure related to the pandemic is really important. Another point that I would make sure people remember is doing those basic self-care things. So for individuals who, let's say, they're in social isolation, they're having to work from home, they're not used to these new routines. So we think about, what can you do to get back to a schedule? Even if you're working from home and you've never done that before, it's important to get up, start the day kind of as if you might be going into the office, but keeping a schedule, keeping some routines, because we know from research that when people lose routine and control, that increases their feeling of stress. And really the basics are important too. Exercise, for example, we know exercise has been very well documented to show regular exercise decreases anxiety, depression, and stress. So maintaining an exercise routine is important. Not doing negative coping behaviors, which might be, people might find themselves drinking more alcohol or using other substances. We definitely want to caution about that, because while it may be a way to temporarily cope for some people, we know that can lead kind of down a difficult road. So we want to be sure not to do the negative coping strategies. And I think one of the other things is the challenge right now of maintaining social connectedness when we're having to social distance. And I think people are finding really unique ways to do that. But that's a challenge, because we do know social support typically is very protective against mental health disorders. So if we take away that social support physically, we have to find ways to do it in a different way. So I'm sure you've heard people talk about they're having Zoom get-togethers with family. They'd love to be in person, but getting together by electronic means or virtual may be the way to do it for right now. The main thing is to find a way to be socially connected. Finally, something that, again, everyone can do that's relatively easy is learning ways to just physiologically and physically relax. So some of the best strategies that we know that are supported by research are things like deep breathing, progressive muscle relaxation, prayer, meditation. All these activities help provide a sense of relaxation in the body, which also helps reduce our stress and anxiety. So again, there are multitudes of ways to cope. And I would remind people too that the internet has a wealth of resources on coping with COVID-19. So, for example, the American Psychological Association has wonderful resources for people who might be listening today. And finally, I would remind people that for some individuals, especially for individuals who might suffer with more severe anxiety, depression, or other mental health states, those individuals, they want to keep their treatment up while they're going through this. One of the things I felt that our healthcare system, I was really impressed what we did, because Baylor, Scott & White, at the beginning of the pandemic, we quickly moved to telehealth resources, particularly, for all our providers, but for our behavioral health providers. So what that meant was we were able to continue providing mental health treatment for our patients, and that didn't have to get interrupted just because they couldn't come to the hospital or outpatient clinics for treatment. So I always encourage people not to let their if they have an underlying mental health condition, not to let that drop, kind of similar to what we talked about earlier with the emergency room and the routine activities like vaccinations. We also don't want the mental health pieces to drop just because you're not able to go into the office the way that you might have before. Hospital systems, including our own, have been very creative in getting those telehealth resources to people. So I think there's a variety of ways that people can maintain their mental health. And again, I would finally round back to resilience. The expectation is most people after trauma are inherently resilient. So I think trying to look at this from a positive framework to say that people will cope and they will get through even the most difficult of times.
Dr. Warren, thank you. This is a great conversation. I'd like to maybe go to the dark side, if I could, for just a quick second. This is one of the implications that became pretty obvious from the beginning of this, that A, it was not going to be quick, B, it was not going to be a V bottom, and C, suicides or attempted suicides could become a problem, and they have. What are your thoughts on that?
So again, obviously the suicide issue for people worldwide, suicide is certainly one of the leading causes of death. So you're absolutely correct that in a situation like this where we're having very unexpected, this all kind of came, for most people, I think, relatively unexpected, life-changing in many ways, including financially. And so we look at financial stressors, health stressors. Those are all things that might place people in a potential risky situation, especially if they have underlying depression that's not treated. So I think now more than ever, it's critically important to use those mental health resources that are available. Even something like, I always remind people that the National Suicide Hotlines, those are outstanding resources that are available to anyone at any point. They don't cost anything, but sometimes people just need that lifeline. They just need to reach out. I would also say being aware of friends and family that you think may be having a difficult time, reaching out to them during this time, finding a way to get past the social distancing to reach out to them is important. But, we really we want to employ the same things we try to do to help prevent suicide even before the pandemic. I think now we just have to be more aware. And another thing I'd finally add is sometimes people hesitate to ask someone that they feel might be at risk because they feel like if I ask about self-harm, someone then might self-harm. But now's the time to be open and talking about mental health. If there was ever a time when we wanted to get away from the stigma of mental health, now's the time. We're all experiencing stress due to COVID-19 in different ways. And, we want to use our resources and not let people feel they're left alone.
It almost seems like a cauldron of worst kinds of scenarios. So you're sitting at home, you're socially isolated, physically isolated. Like you said earlier, you're overdosing on media. Your head is just spinning around, and it's getting hot. So what would you tell people to do? Those are all great tips. And if somebody is in that scenario, what should they do right now to help break that pattern?
Well, again, if people ever feel that they are in a moment of crisis, they should call 911. They should go to their emergency room. They can call the National Suicide Prevention Hotline. There are, in fact, interestingly, we were talking about healthcare providers earlier. There are now national hotlines as well to help healthcare providers specifically. So the help is there. There are, in fact, Texas just put out a few weeks ago that Texas has its own mental health hotline. The resources are there. People just have to kind of take advantage of them. And I know sometimes asking for help can be the hardest part, but I think it's a combination of knowing that help is out there. That's the message people need to know. And then again, finding those ways throughout the day so they're reducing risk, right? So they're not having, as you described, they're not feeling stuck inside. They're not pervasively watching the news or on social media, and bringing in some of those coping skills. I would also again argue, though, if someone is really having these concerns about not feeling hopeful about the future, professional treatment is always recommended and is out there and available.
Catch Dr. Warren's full interview on our podcast, The Human Side of Healthcare. It's on all your favorite podcast players. We're going over to Green Oaks to continue this theme next with CEO Tom Collins on the human side of healthcare. Stay with us.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome to the Human Side of Healthcare. Steve Love, along with Thomas Miller. Thank you so much for being with us today. You know, in many of our segments, we've talked about treatment, whether it be medical treatment, chronic illness. We've talked about mental illness, behavioral health, substance misuse. But we're going to talk about a topic today about once you're through that treatment or still going through the treatment, returning to work or returning to your job. And we couldn't have a better guest to discuss this than Tom Collins. Many of you know Tom. He's the CEO of the Medical City Green Oaks facility here in Dallas. Tom, thanks for being on the show.
Oh, thank you. It's good to be here.
You know, when we think in terms of a physical crisis, an injury, behavioral health issues, can you talk a little bit about how that could create a barrier when it's time for an individual to return to work?
Yeah, we have a program called Work Returns. We started 14 years ago. You know, in my 40 plus years working in behavioral services, one of the hardest things to do is measure absolute outcomes. And this is the one program that we can measure outcomes. And it is one of the most effective services that we offer. And here are sort of the dynamics. It's an interesting issue. We saw 14 years ago that workers' compensation was a huge expenditure for employers. A lot of people go out on workers' comp and they stay out for a long time. So we started, Dr. Mike Ashworth and I, to sort of dig into why that issue costs so much money and what can be done about it. What we came to find was that people who go out on workers' comp, often they are the most stellar employees. They have had the least time away from work. They're the most dedicated people. And then they have a physical injury. And it is not only traumatic physically, but emotionally. It's like a post-traumatic event. And so we started talking to some of the internal medicine doctors, and they would say, you know, we get these people medically cleared, so whatever injury they came out with, we think is resolved, but the people are very reluctant to go back to work. And I think the more we looked at it, we discovered that all the good things in the workers' comp program and the benefits program sort of conspired for a bad outcome. And when I say bad outcome, I mean people staying out of work much longer than they needed to. I'll give you an example. So you have a person who has a physical injury. They go out on workers' comp. The physical issue is resolved, and yet they have huge anxiety. Because once they say that their issue is resolved, their medical issue, their workers' comp drops. They go back to work, and if the issue resurfaces or isn't resolved, then they have to use their own health insurance. So, they're not intentionally trying not to go back to work, but they are truly anxious. So once they see the internal medicine doctor, once we get them to refer to work returns, we start working on the emotional trauma. And the outcomes over the past 14 years are really spectacular. We have 75% of the people that we see are back to work within 5 weeks. It's sort of an interesting coincidence when you look at the expenditures from employers. When you look at the research, they say that 70% of the expense is unnecessary. That is, people get their medical issues resolved with 30% of the expense, and then the rest is the emotional trauma and getting them back to work.
You know, that's very interesting, Tom. And to drill down a little bit, and I was just thinking as you we're discussing this, not only work-related injuries, people with chronic illness, people with, heart conditions, congestive heart failure, people that have had open heart surgery, many times have bouts of depression, many times have things that impact them that would make them probably not want to go back to work, not be as productive. So if an individual, one of our listeners, had, for example, a chronic illness, and they got the physical aspects of the chronic illness, at least to a point they could function and go back to work, but they're experiencing emotional issues, would they be a candidate for this program?
Yeah, that is such a good question. Yes, many people who have physical injuries, even if they're retired, it's the same thing. There is a post-traumatic effect, and people are afraid to get back into life, basically. They're afraid they're going to re-injure themselves, or they're not ready, or they're going to end up pushing themselves further back into the problem. And yeah, we have great success with those people. It is a matter of sort of building emotional confidence again, reducing the anxiety, and getting ready to give it a try, whatever it is, work, life.
And Tom, as we look at this and we're thinking in terms of the individual that's going into this program, look at the benefits for the employer. As you get these people back to work earlier, can you expand a little bit on the benefits to an employer?
Yeah, that is one of the most sort of mysterious parts of work return. We've worked with many employers, many large employers, to implement work returns. So when we work with the employer, we say, we can get people back to work 70% faster than your experience. And they think that's spectacular. So we say, all you have to do is require the people to come to the work returns program. And they say, well, we really can't do that. Either there's a union, or the workers' comp benefit doesn't allow them to sort of compel the people to go. And they say, so you'll have to work with the internal medicine doctors. We work with the internal medicine doctors, and the issue there is that internal medicine doctors will say to the patients, are you ready? And the patient will say, because of the trauma, no, I don't think I'm ready. I don't want to go to that program, right? Because they all see it as the sort of road back, and they just don't feel ready. The ideal situation would be if an employer would use work returns from the first day the person had the disability. Then we'd work with the internal medicine doctor, or as HCA, we have relationships with a vast network of internal medicine doctors. And together we would work to get the person back to work. We'd work on the emotional, the traumatic part, while the doctor resolved the medical issue. But the fact is, people stay out 70% longer than they have to based on the medical disability.
That's an interesting statistic, 70% longer. As you were talking, I was also thinking, you helped put this program together. It's been in place for a few years now.
Yes. Yeah.
People, especially our listeners, would be interested in metrics, outcomes. What would you say the success rate has been?
Well, as I said, 75% of the people we see are back to work within 5 weeks. And these are people, some of whom have been out for 2 years. What they really need is support and therapy on the anxiety. They really want to get back to work. They're scared. They're afraid if they go back to work, or if they go back to life, they're going to relapse. And the system is set up so that if they relapse, workers' comp is over. Then the whole responsibility is back on them, their health insurance, their deductibles. And really, they just need sort of guidance, support, reassurance. When people go back to work, we keep working with them so they can continue to come to the groups and individual therapy while they're entering back into the workplace, or whatever part of their life they're trying to get back up and running.
So how do people find out about this program or get enrolled?
Yeah, many are referred by internal medicine doctors who work with people, and they say, your medical issue is resolved, and the patient will say, I'm not ready. I just don't feel ready. And we have relationships with many internal medicine doctors who refer to us, and then together we get them back to work, as I said, 75% within 5 weeks. What would really be effective is if we could expand that to an employer, large employers, a network of employers, And we could do it simultaneously. We could work with whatever internal medicine doctor to help people get their life back. And they could. Like I say, there are very few things in behavioral services, even, drug addiction programs talking about success rates. This one, the research we've done is really solid, and the outcomes are spectacular.
Could you take us behind the curtain a little bit? What are some of the elements of this program? What do you do, and what would somebody expect if they went into it?
We do group therapy and individual therapy. So we have a group of people who are experiencing the same kind of trauma. They've been out on workers' comp for some kind of a disability that at this point medically is resolved. And we just talk about the fears, the anxieties, offer support, talk about strategies to get back to work and stay calm and re-enter the workforce.
Tom, as you've been answering the questions, I thought about this, and I'm sure you have as well. You look at like a program for athletes. Let's say you have athletes that injure themselves. I could see how while they're not per se going back to a working job in the sense of what we were thinking, still it is a profession for them. They would be candidates for this type of program too.
You must have a background in healthcare. Yeah, we've had many athletes and many professional athletes, and of course I can't say who, but yeah, it works for anybody who has had a physical injury. And most people who have had a physical injury at some point, when the decision comes to have to go back to work or back to whatever their life is, they experience anxiety. They're worried that they're not ready. And we help people get ready.
Thank you, Tom. And if you are in HR or know somebody who could benefit from this program, the best thing to do is to search Medical City Green Oaks Hospital online, and their contact information is readily available. And they are there 24/7. Now, we're going to end on a high note today. When we come back, we're going to talk about, first of all, a local emergency situation that you can actually help be part of the solution. And then a very heartwarming program from a North Texas hospital that helps kids, of all things, to play. The Human Side of Healthcare will be right back on 1080 KRLD and radio.com.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is the Human Side of Healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome back to the Human Side of Healthcare. Steve Love along with Thomas Miller. We just heard in our previous segment about back to work. Hopefully things are going to get back to normal. And hopefully we're not going to have another wave. So as we're getting back to normal, there are a couple of things, Thomas, I want to talk to you about. First and foremost, we're now doing procedures, diagnostics, and surgeries. Some refer to them as elective surgeries back at the hospitals. It's very safe, and people should not be afraid to come in and get that done. And as we're doing that, we're going to need blood. Since we've had COVID-19, a lot of blood drives have been canceled, and blood is such a precious commodity. We've got to get our listeners to think in terms of calling, for example, Red Cross or Carter Blood Care and going and making a blood donation at their local office.
These are being done now by appointment, so it's very safe to go in and do this. And I remember back when the whole virus thing first broke, we talked to Dr. Merlin Sayers over at Carter Blood Care, and boy, did this town respond in an amazing way. Well, they need that again, because as this thing has played out and everybody's focused on other things now and trying to get themselves back to normal, that blood supply is critically low again. So if you could help us out, like Steve said, contact one of those two organizations, make an appointment, go in and give some blood.
In fact, sometimes there are 600 or 700 patients on a given day that need blood transfusions just here in North Texas. And Thomas, the other thing, it's kind of good that we're getting back to kind of the human side of healthcare and not talking about COVID-19 constantly. It's kind of refreshing. And some of these segments are just so good. And there's so many good things being done here in North Texas.
You know, we recorded several segments back in February before the virus broke out, and we've had to shift the focus of this show, obviously, to the biggest healthcare story of the millennia almost. Well, certainly this millennia, I was saying of the last 100 years, maybe not so much, but definitely we are back on track now. And one of the great facilities in America is right here in the Metroplex, Texas Scottish Rite Hospital.
You're right. And we're going to have Dana Dempsey talk to us. She's a therapeutic recreational therapist, and she's the director of therapeutic recreation at Texas Scottish Rite Hospital. What a great interview.
So here is Dana Dempsey to explain Texas Scottish Rite's therapeutic recreation program.
Basically, what therapeutic recreation does is we help children develop the skills so that they can be actively engaged in recreation and leisure. What I mean by that is that basically what we do is whether we're working with our inpatient program, children who are in the hospital, or for ambulatory care clinics where we'll get consulted down to work with the family and provide leisure education, or if we provide some of our community outreach programs. And those are programs that are inclusive, that a child can register for and participate. Basically, we're trying to help children who have a disability or a chronic health care condition that has had a negative impact on their ability to participate and engage and play in recreation. We're trying to help teach them the skills or the knowledge that they need. Now, on the inpatient unit, when we get a referral from a physician, and typically we will get a referral for a child who's going to be there a little bit longer than our average length of stay. Average length of stay is about 3 to 4 days, but we tend to get referrals for those children who might be in for weeks. Let's say a child has scoliosis and they're going to need to have spine surgery. And as part of their treatment, they have to have a halo traction on. They could be in the hospital for a number of weeks, letting halo and the traction do what it needs to do to help reduce the curve. Well, people aren't used to walking around with halo traction on their head. So how do you teach children to modify the activities so that they can still participate and play and have friends and do activities that are fun for kids? I mean, children want to be children. They want to be able to participate and play in activities. The other thing with the inpatient unit, because we do get children who oftentimes have been set on the sidelines, they're not as actively engaged as their able-bodied peer may be or typically developing child may be. Many times they've not had as much practice with how to play with other children. So, for example, I could show you how to play wheelchair tennis. I could teach you how to hold the racket, push the chair, get to the ball, return the ball. But if you're a jerk, nobody wants to play with you. So besides the physical side of the activity skills, there's also that social side of it, the problem-solving side, even the emotional side, feeling good about yourself, feeling though you're part of something bigger than yourself, making friends, not being as isolated. So whether we're on the inpatient unit, and oftentimes I describe this as maybe think of 3 legs to a stool. One leg would be inpatient. The second leg would be the ambulatory care consults. The vast majority of the children that we serve at Scottish Rite come through our clinics, and many of them never need to have surgery. So when we get a referral for a child, maybe there's been a change in their functioning, or maybe this is a child, let's say, who has cerebral palsy, or maybe they have a missing limb and they're not exactly sure how to get involved in activities or even what's available in their community. So in that regard, we provide what's called leisure education. So we are able, based on the child's interest and their needs, help the family determine what types of goals they may be working on for their child. And then we're able to do the research to look out in the community. We're here in Irving, Texas right now. And so a family may be new to Irving and not know what's available. They don't know that there is a Miracle League here in town. They don't know that the City of Irving Parks and Recreation provide adapted and inclusive recreation programs. So unless somebody knows there's a resource that could meet their need, they simply go without their needs being met. So much of what we do connecting with the community is helping our families know where and how to connect their children so that they can get their needs met. Now, one of the questions you asked was about benefit. What kind of benefits? What are the needs? It could be improving strength, improving balance, improving endurance from the physical side. I already mentioned social and emotional, that sense of self and competence. So there could be a variety of needs, and part of that is done out in the community. The third leg to the stool really is our community outreach programs. Those are programs such as our adapted cycle evaluations, our Chance to Dance program, which is for children, young children, patients of the hospital, and they learn ways to do adapted dance and creative movement. Our Learn to Golf program, Summer All-Stars, or the recreational camps that we have.
What an incredible program they have at Texas Scottish Rite. That is one subdivision of it, and Dana Dempsey is just absolutely delightful director of that. If you are interested in that or know somebody or a family member or friend who would be, the best thing to do would be to contact Texas Scottish Rite Hospital for Children and find out where they are currently with COVID-19. We actually talked to Dana before the virus outbreak occurred, and they can give you the latest of the programs that will be offered this summer and how they're doing it.
You know, when we first started the human side of healthcare, I was a little nervous because I'd never done radio before. But, you know, these shows are really fun, and these guests are just outstanding. And not only was this week's show good, I can't wait until we have next week's show. We're going to do a lot about, let's talk about things other than COVID-19.
Amen.
You know, and we're going to have a hospital CEO on that's going to tell us a little bit about running a hospital, things you have to consider and do. And then we're going to bring in 2 orthopedic surgeons that are going to talk about joint replacements and how they improve the quality and lifestyle for so many people.
Absolutely. We are back to work, and if you've got a pain in your joint of your knee or your hip, it is perfect time to get it replaced. And we'll talk about all of that next week on the human side of healthcare. And meanwhile, let's keep wearing those face masks.
And social distance.
And stay safe. We'll see you next week on the human side of healthcare here on 1080 KRLD.
And radio.com.